the meeting to order. We're doing things a little different today. We're going to start with the Civil Service Board, adjourn that real quick, start the Board of Health. One amendment to our agenda is we will not have our ethics training today. We will push it off to the next month or some other time. So with that said, Mr. Diamond, civil personnel changes.
Yes, Dr. John, there's only one item on the Civil Service Board, and that is the personnel changes for March of 21, which were included in the advanced packet. There's no vote necessary, but I'm able to answer any questions if there are some.
Any questions? All right, hearing none, thank you. I'm going to adjourn the Civil Service and call the Board of Health meeting to order for the month of April. Could I get a motion to approve the conduct of the meeting by electronic means?
Sure, I'd be happy to give that motion.
Please, would you mind reading the thing?
Yes. I move that the items on the meeting agenda constitute essential business of this board. Meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans considering the COVID-19 outbreak, and any conflicting with the governor's executive order permitting electronic meetings be suspended.
Okay, so that's a motion. Is there a second?
Seconded.
Any discussion? All right, hearing none. Ms. Franklin, we're voting now.
Aye.
Okay, I got it. Dr. Smith?
Aye.
Mr. Frederick?
Aye.
Dr. Campbell?
Aye.
I also, aye. All right. Minutes from the March 11th meeting were circulated. Any discussion or comment or approval?
I move approval as distributed.
Okay, thank you. Is there a second for that?
Second.
All right. Any discussion? All right. Now Dr. Campbell's moved up on my screen. Dr. Campbell.
Yes.
Aye. Ms. Franklin.
Aye.
Dr. Smith.
Aye.
Mr. Frederick.
Aye.
And I also approve the minutes. Thank you. Next item on the agenda is the approval of grant applications and approval of grants and contracts. Mr. Diamond, can you take those, and then I think Ms. Lester may also chime in at some point.
Sure. There is one application included in the advanced packet. It's for the CDC's National COVID-19 Initiative. The advanced packet had $2 to $9 million, and we were told that our award would be up to $4.9 million. And I think Ms. Lester is going to expand on, what all that involves here.
Yes, I listened to a call this morning, and Celia Larson has also been working on this grant. It is a non-competitive grant for 24 months. The population of focus are individuals who are at higher risk and disproportionately affected by COVID, including the higher risk, underserved, homeless, and racial and ethnic populations. There are 4 priority groups, priority strategies, and we are currently connecting with partners to develop the strategies and the work plan. Partners include safety net providers, behavioral health providers, other metro departments, faith communities, community-based organizations, and other nonprofits and academic partners. So Celia Larson has already pulled a team together to work on this. It is due May the 3rd and starts June the 1st. Of this year. So because it's non-competitive, there is no scoring. We will just submit our work plan and our projects and probably be funded. So we're excited about this. Thank you. And if you have any questions, Celia's on and she can help answer.
Great. Any questions?
I have a question. I'm wondering if there's a certain percentage that must go to community-based organizations as opposed to academic partners or other agency departments?
No, the application at the local level does not require any percentage allocation by involvement on any particular entity or group. The state application, I think the state is applying as well, and they do have some requirements regarding rural environments, so the rural communities. I'm going to be speaking with the state tomorrow. I think that we want to assure that we're developing our application in concert with their thoughts and feelings to, of course, and approaches to get, of course, try to leverage as much as we can to make these differences and also avoid redundancy and duplication and so forth. So that's a challenge of this grant, even with the other grants that are currently being compiled in the community, is to assure that it's in being aware of and complementing each other's strategies.
Okay, thank you. And then my follow-up question, if community-based organizations were interested in being part of this effort, do you envision sharing a process in which they can inquire with your team?
Yes, in fact, that would be wonderful to, I'm in the process of sending out as many partners, through partners, to get to as many entities as possible as we put this together. With the amount of funding, we were hoping, of course, the 9 million, but this is a substantial amount to where we can still assure that we're connecting with the community-based organizations to assure that we are able to reach deep into the community with cultural and linguistic appropriate approaches to maximize our efforts in all the strategies that we're going to be undertaking.
Thank you, Dr. Larson.
All right. Any other discussion? I would entertain a motion for approval of that grant. I assume that's what we need for this.
That's correct.
Okay.
Motion to approve.
Dr. Smith?
Second.
Ms. Franklin, great. Any other discussion? Hearing none, vote time. Ms. Franklin?
Aye.
Dr. Smith?
Aye.
Mr. Frederick?
Aye.
And now Dr. Campbell went to the bottom of my screen. Dr. Campbell?
Yes, aye.
And I also approve. I don't know how that happens. There you go. All right. Approval of grants and contracts. Mr. Diamond?
Yes, Dr. Jahangir, there were 6 grants and contracts included in the advance packet. There were no additions after the advance packet came out. So item number 1 is year 3 of the Nashville Strong Babies Grant. Item number 2 is an amendment to our Ryan White Part A COVID-19 grant, and that just extends the term for 1 year. Item number 3 is the Ryan White Part A grant for the next calendar or the next grant year. Item number 4 is an amendment to our TB grant for the second year of the 2-year grant. Item number 5 is the a consultant grant for ending the HIV epidemic grant. And item number 6 is an agreement for the data across sectors health, the DASH grant for MPHD to work in conjunction with the PrEP Coalition. So I'll entertain any questions anyone has on that. If not, we would ask for a motion to approve.
I have one question. Just on the Ryan White COVID-19 response grant, is there already funding? Is there funding left in that? It's an extension, but I'm not sure what we're extending.
Yes, we're asking to extend the time frame. They gave us, I don't have the exact amount in front of us, but it was about $900,000 to spend on that. And they gave us a very short time frame initially to do that. And this just allows us to have a lot more time to plan and spend this money.
All right, thank you.
All right. Any other questions? Is there a motion to approve these?
I move approval.
All right. Is there a second?
Second.
Thank you. All right. Ms. Franklin?
Aye.
Dr. Smith?
Aye.
Mr. Frederick?
Aye.
And Dr. Campbell?
Aye.
And I also approve it. Okay. We have Ms. Lester and Dr. Wright. Dr. Wright, thanks for joining us. for the director's interim or report of interim directors. There you go. So the floor is yours, please.
Well, I guess I'll start first, Tina, if that's okay.
That's fine. Go ahead.
So we continue to obviously vaccinate with the vaccine that we've got. We're currently at over 30% of Nashville, Davidson County now having received at least their first dose of vaccine. We're getting about 92% of people returning for second dose for those doses that do require a second dose. Obviously, we're able to have a 10,000 dose event, and that went very well. And we're working hard to continue to get into our underserved and communities of color to get the vaccine to them. I think we're doing fairly well with that. And obviously, we would always love to be doing better, but numbers have been pretty good in that regard, especially in comparison to a lot of other communities. But we continue to work with the advisory group we've got on that and take their recommendations and suggestions to try and improve that further. So I think that's the highlights of what I have to add, and I will turn it over to Tina.
Okay. As usual, most of my remarks are in the director's update, but I just wanted to point out that we have gone ahead and posted the position for the diversity, equity, and inclusion person. It is posted on government jobs. It has been posted internal and external, so we have a couple of weeks on government jobs. And this week is Public Health Week, and we have arranged to have just a small celebration with staff. We're going to give cake tomorrow at lunchtime to show appreciation for the work that they've done during a difficult year and have really stepped up to participating in all of our efforts as much as possible. We've pulled together a small team of approximately 12 people within the health department who have not had the opportunity to serve in any capacity during our COVID response because of the work they normally do. But we felt it was important to have a larger presence of Black and Brown volunteers to go out with our strike team in the communities that they are doing vaccination to lessen fears and to increase the uptake of the vaccine. We started that group about a week and a half ago, and they have rich experiences in talking with people and encouraging them. We've also partnered with Neighborhood Health in St. Thomas to vaccinate 100% of our homeless population by Memorial Day. And there are 19 organizations that are involved in this effort. We've lost two key personnel in the Ryan White grant. We mentioned Rajiv last meeting. The second was his last day, but we've also lost a finance advisor to the Ryan White grant, and the second was his last day. So we are now transitioning the program. We have a interim director. Her name is Miss Beverly Glaze Johnson. She has a wealth of knowledge in the HIV world and will serve well until we can get a person. It might be her or someone else. We also have transitioned the program to Dr. Shaw Kai. She is now the administrator for the Ryan White grant. It was under our bureau, but due to her knowledge of infectious disease and her desire to really work with that group, they have moved over to her. And we're still working with them some, but now Dr. Shaw Kai is the administrator. And let's see, I think that's all I had in my notes to bring up. I'll entertain any questions if you have them.
Tina, could you elaborate a little bit more about the strike team and the team that you've pulled together that I think you said that haven't really had a chance to serve on the front lines?
Well, they
That's what you
haven't
were alluding
been as
to.
involved, and the strike team normally goes out to different, they have set up all the locations for the month of April and most of May to go out and provide vaccination in our neighborhoods of underserved families and communities. And it's mostly, there's very few African Americans on the team. And so after speaking with some of the community folks, we felt it was important to have some of our staff that are minorities to go out with the teams to just to provide some comfort and some information. I think that communities of color oftentimes want to see that there are folks that are in the medical field or the healthcare field that are doing the work, and they would like to be able to talk with them. I was at Hadley yesterday for the morning session, and it was a really good experience. People were full of questions and very grateful for the fact that, Hadley, Matthew Walker was there to do the vaccinations. They've done over 1,500 as of yesterday. So they're on target for their goal. But yeah, it's just that they haven't had a chance. And so we asked them if they wanted to go out with the strike teams or with other community groups to provide information and to help with the traffic control. I had nurses at Hadley. And it's just, I think it's good for them to get out and have that experience.
Sounds good. I'd like to make myself available as a volunteer to support in any way that makes sense for the teams. So thank you, and just put my name down and let me know how I can help.
Okay, great. Thank you. I'll be calling you.
Thank you. And tonight, thank you for that. I actually had the opportunity to go to Watson Grove on Tuesday when they were doing the event there. And it was just so great seeing these strike teams, individuals, and they all seemed to really enjoy being there. So I appreciate your willingness to also volunteer, and anyone else willing to do that, I'd encourage it. Great. Anything else from you two? Great. Well, it's maybe record setting.
I know.
Don't hold your breath. Again, we're going to pay the piper one day, guys. Remember this. So from my end, here's where I want to just take a few minutes. So Ms. Lester mentioned it's National Public Health Week. And I always find the, recognition weeks kind of an awkward moment, right? But I think in this case, I think it's an understatement to give public health professionals a week. We almost need to give them the whole year that they've given up to all of us. So I'm just so proud of our colleagues at Metro Public Health and around our community because of where we're at, right? And I just want to highlight some of those where we're at. So far, 32% of our residents have received at least one dose of the vaccine, and 18% of the counties fully vaccinated. This is higher than the state. And this is higher than most of the counties in around us. And I don't know the exact number, but definitely puts us top 5 probably of all 95 counties. And the counties that may be a little higher of us are those that are really small, and maybe they're just able to knock them out real quick. So thank you all for that. Equally important, 91% of the deaths in our county have been in individuals over 55 years or older. And of those who are 55 years and older, there's been a very deliberate vaccination effort, and 59% of those individuals over 55 have received a vaccine. And when you look at the breakdown, 51% of whites over 55, 43% of blacks over 55, and 41% of people of Hispanic ethnicity over 55 in our county have received their vaccine. And I think those numbers are yes, I would love to get all those numbers above 70 and 80, but they're going up together, right? I've been following them for the past several weeks, and they're going up together and together and together. And I think it's not because it's because of intentional effort to make sure everyone in our community has access. Some of the efforts that Ms. Lester described, Dr. Shai Kaikai, Leslie Waller, Ms. Lester, and so many other people I hate to even start naming, Dr. Wright, have spent so much effort to make sure that this happens, and I'm grateful to everyone. And so now we're vaccinating everyone over 16. And it's, you know, you guys have heard Mayor Cooper say we want to have 50% of Nashville vaccinated by May. And we're on track to do that. It's going to take a lot of work. So please keep preaching the gospel of vaccination this month. And so I tee all that up to say, you know, we have to start as a department looking forward. You know, the public health emergency we all have approved is set to expire June 30th. And, you know, I didn't put it on the agenda for this month to extend it to the end of July because I want to see what happens over the next month. And in May, we'll reevaluate that, and if need be, but we still have some leeway. But it is, you know, maybe that may be all we end up needing to do, right? I mean, I can't predict the future, but we're heading in the right way. And as we start heading in a way in which one day hopefully we'll be beyond COVID, this is the time for our department to really look at where we're going for the future. There's the funding opportunities, one being what Ms. Lester mentioned. The other one is, you know, I believe there's about $250 million coming to our city for public health from COVID, right? And that won't all come to our department. That'll go to help some hospitality industries and other areas of society have been impacted, but a good chunk of that will come to us. And it gives us an opportunity as a department to really maybe establish some infrastructures to take care of the city's public health needs moving forward. So with that said, the strategic plan that is being finished by the department, and hopefully will be presented to the board in the next, you know, short time frame, will be the beginning of us thinking through what those next steps for the future are. So know that that's coming. We're going to digest it, and we'll help. It'll be our responsibility to help fine tune it and help operationalize it as moving forward. And then that leads us at some point, and that point is not now, to discuss, you know, what we do long term with the director search. And again, my feeling right now is we're still moving forward in the crisis. We're this is not the time. We have the steady hands of Ms. Lester and Dr. Wright have been so critical, and I just appreciate that. But know that it is something on the radar. And that may be several months down the road. But as we start looking at a strategic plan, as we start looking at where we are beyond COVID, these are the types of discussions and things we need to start thinking about. So with that said, I mean, that's my quick spiel of things that are on my mind. I would love the opportunity we're 22 minutes into this meeting, right? So if there are any of my colleagues on the board or anyone else that wants to have maybe think about, you know, things to just start thinking about or want to put out there, since we rarely have a time to dialogue for a few minutes within this frame, I'd welcome that. Obviously, there's nothing we can vote on, nothing we can act on. But if there's any discussion that based on anything I just talked about, I'm glad to entertain it. So there you go. Floor is everyone.
Yeah, go ahead. Yes. When we're looking, I haven't had a chance to, just as the rest of you had, to see the strategic plan draft, but we do have a lot of conversations about determinants of health. And one thing that keeps coming up, it seems, when we hear reports is housing. And I feel like we do a lot to address the needs of people once things happen to them. And I think we do some prevention things. If there is some way we could develop stronger strategic partnerships around addressing those determinants of health, and how can we change those things as opposed to reacting to those things. And I don't know what those look like. I'm sure that a lot of the staff here probably does have some, and Ms. Franklin, who's a professional in this area, probably has some ideas as well. But it seems to me that might be an important place to look strategically.
David, I think you're right on, and I think that one benefit of us coming through this pandemic is that it really gives us a firsthand understanding of how those social determinants of health play out. So we know better. I think in the public health community, that conversation has been had for years and years and years. But as a community, we all know better. And so I think there is a path forward for us to work with our agency partners. And so that's exciting.
Great. Any other thoughts? the future is bright. I think that's what I hope to leave you with. I might not be saying it with much enthusiasm, but I really feel the future is bright. So.
Alex, I don't really have very much to add other than what you've already said. I do want to encourage everybody. I know that there was a lot of sentiment, and especially in some of the African American community about being guinea pigs with the vaccine. When the guinea pig session is done, I want to really echo the sentiments of Dr. Hildreth at Meharry and let people know that we're well past that phase. And, it's time to really put our money where our mouth is and get ready to get back to a semblance of what we used to be. I think that we've picked up some good habits as far as health and hygiene. We've had our lowest numbers of flu in several years. And so, it's been very encouraging for that standpoint. And I think that we can learn a lot from this period of time, but we definitely need to have everybody vaccinated. So I really encourage everybody who's having thoughts about it to talk about it and to come to their own conclusion, but, really try to work towards being vaccinated so we can get back to normal. But I think what you said was well said.
I do have a question with the breaking news today, and I don't know if anyone is prepared to even respond to this or has enough information. But with the news with regards to Johnson & Johnson's vaccine, how do we as a department start the process of learning more about the Johnson & Johnson vaccine and perhaps the side effects that have occurred in other locations in the U.S. that have been reported, rather?
Can you elaborate on? I'm not sure.
So today, the news, and I'm pulling up my phone. Hold on. The news actually, there's a few news stories on the Johnson & Johnson vaccine.
Yeah, I can speak on it a bit.
Yeah.
It was so in Colorado, they halted all of the vaccinations for Johnson & Johnson. They had 11 adverse reactions noted there in Colorado. And, again, to I guess the point that we're going to make, it's still not quite a whole lot known about it other than the fact that they did really immediately stop the vaccine. So I think that there are a few other counties in the country that have started to follow that lead. And I think, it's a very important thing for us to think about. I'm always in favor of knowing exactly what occurred as much as we can before we make a knee-jerk reaction. But I think that, that's certainly concerning and something we need to have on our radar.
Thank you, Dr. Smith.
I can speak just a little bit in that it was a single site, and I think that we're going to have to know more. They're looking at that vaccine as a whole in that area. So you would just have to keep following it very carefully and closely to see what's going on in that particular site as to why they saw so many issues. So more to come.
And is it fair to say, to our knowledge, out of the over 10,000 more than that we've given in this region, we have not seen any serious side effects? Or
I mean, in the immediate time after giving our 10,000 doses, I think we had 2 individuals that had a reaction and ended up being transported to hospital, but did not have any significant stay or anything else. It was a typical kind of allergic reaction that was unexpected. So, yeah, and that's kind of what we've been seeing across the country. So it's concerning about why this particular site has the issues that it had. So I think we have to wait and see what happens from that. It doesn't mean the vaccine's bad yet. We just have to see what that leads to and what the issue behind that is. And a lot of things that could have been personal error there, but we'll see.
Yeah. So more to come. One final thing I want to mention. I've forgotten my remarks here. As we start moving maybe towards beyond COVID, one thing that we started in the COVID process was the data sharing with first responders, police. Part of the reason we initially did that, if you all remember the dialogue we had around that, was to, protect our first responders, protect the people being transported. Well, everyone's not had an opportunity to have a vaccine. Dr. Wright, Ms. Lester have recommended, and I've spoken with Director Chief Swan with Nashville Fire. Seems like we are now to a point where the purpose of that program is no longer, the benefits don't outweigh the risk anymore, where previously I think that was maybe different. And so the recommendation was made by Dr. Wright to stop that program back to the way it was before COVID. And I think that recommendation makes sense to me, and like I said, it made sense to our first responder community, or at least Chief Swan. So I just want to make the group aware of that as well. Sorry, I just hadn't written it down. It just hit me again. So there you go.
Is that something that we have to vote on, or is it just something that the directors follow through?
I think that's a director decision. It wasn't in a, yeah. So I just want to inform the board of that decision. And I think it's one that I support, because again, the purpose is we're beyond it now. Okay.
I agree. I think it served its purpose and its time is up. It makes sense.
Great. All right, colleagues. There's nothing else. I think we beat the other meeting by 4 minutes from last week. This is not a race. We are getting our job done, but I'm very grateful to everyone. Again, let's push through. Help me pass the gospel of the vaccine. We're at 32.5%. I just got the most recent update as of during our board meetings. 32.5% of our city has received one dose. So we're ticking up slowly. So thank you all so much. And I adjourn the meeting, and we'll see you all next one.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.